ALS, also known as Lou Gehrig's disease, is devastating. It gradually paralyzes people because the brain is no longer able to communicate with the muscles of the body. For ALS Awareness Month, we're joined by Dr. Lawrence Carngut, the director of the Calgary ALS Clinic, to tell us more about some exciting research underway right here in Calgary into new treatment options. Good morning to you. Thank you so much for being here.
Thank you for having me.
Well, why don't we start right at the beginning? So first of all, what is ALS?
So as you said, ALS is a devastating illness that strikes in the prime of life and can really affect anybody. We know that about 1 in 400 people will die of ALS in our society, and to now we have not had a treatment that's been effective in slowing down this disease.
Wow. How many patients are we seeing here in southern Alberta?
So in southern Alberta we see 150 patients at the Calgary Clinic.
Wow, and such a devastating disease, and not a lot of treatment options as you're suggesting.
Exactly.
Wow.
Yeah.
So tell me a little bit about what you've gotten happening recently, which is the new drug that was approved south of the border.
That's right. So we're very encouraged by the fact that a new medication has been approved by the Food and Drug Administration in the United States just on May 5th, so this is all very new. It's a drug called Radicava that appears to slow progression by about 1/3.
Okay.
So it should slow down the disease, and so we're just waiting for this to be hopefully approved in Canada soon and become available to patients.
That's exciting. What does that mean for some of these patients to have that a little bit of time?
Well, it's hope, right?
Yes.
It's hope, it's encouragement, it's something, and we don't know how well it will work in any given individual, so in some it may work more, some a bit less, but it's hope to prolong life.
Absolutely, absolutely. Now here at home, you're also working on a new treatment option. This is very exciting research. Tell me a little bit about it.
That's right. So we've been working with an old drug, an older medication for the past 3 years, trying to see if it can be helpful in ALS. The preliminary studies are very promising. We just completed a clinical trial in Calgary of 25 patients with ALS, and again, it looks very promising. So we're now, due to the Ice Bucket dollars, all those great donations.
We all remember the Ice Bucket Challenge, for sure.
To ALS Alberta, and of course that's what this is resulting now in a nationwide study at 9 universities.
Wow.
And we're going to be studying a larger number of patients to really try to prove that this drug slows down this disease. And the nice thing is it only costs about $100 a year to be on this medication, as opposed to, you know, $150,000 a year or for some of these other medications. So we're very excited to see the results of this.
That's wonderful. Can you tell me sort of in a simplistic way how this medication works and what it does?
So basically, as the nerves break down in ALS, they suffer from electrical malfunction. So it's just like an electrical wire that's not working properly. And what this medication does, we think, is allow the nerves to function electrically for longer. And so it preserves strength, we're hoping, and preserves breathing, and so prolongs life. But we haven't proven this yet, but that's what this larger study is all about.
Wonderful. Do you know yet if it has any serious side effects or implications that way?
So as you know, it's an old medication, so we know it well. We know it well. Our colleagues in psychiatry have used it for really decades, and so it does have side effects, but we're using lower doses, and we think that so far the risks are worth it, given the potential benefits.
Wow, that's very exciting. So if you're moving into this larger trial, how long do you think it would be before patients here might be seeing something like this available to them?
You know, so this trial will take a year or two to complete, as the way these things go, but the drug's already approved and available, so if it's effective, then we can start recommending it. We don't recommend it at this point because you can't prove that it's worth it for patients to take, but if it's proven effective, then right away.
Wonderful. That's great news. Thank you so much for being here. It's so nice to have a little bit of hope when it comes to ALS.
Thanks for your interest. Thank you.
Thank you.